Hi, good afternoon, viewers. Today I have with me Dr. Manjunath Malige, Director, Diabetes and Endocrinology. Welcome, Doctor. Thank you for joining us in the live. And today, we are going to discuss today on hypothyroidism,
That's right.
which is very common now in all age categories.
That's right.
Doctor, can you please provide us an overview of what hypothyroidism is and how it affects the body?
Yeah, sure. The hypothyroidism basically means an underactive thyroid, which essentially means that the thyroid gland, which we all have, is not producing sufficient quantities of thyroid hormone that the body needs. So there essentially is a deficiency or shortage of thyroid hormone production, and this is known as hypothyroidism or underactive thyroid.
Okay, doctor. Doctor, what are the key symptoms that an individual with hypothyroidism commonly experience?
The common symptoms of hypothyroidism are weight gain, hair loss, tiredness or lethargy, dry skin, irregular periods in women, repeated miscarriages or abortion in women, infertility, and inability to perform mental tasks optimally. Amongst these, the main symptoms are weight gain, hair loss, dry skin, and irregular periods.
Okay, doctor. Doctor, how to prevent hypothyroidism and are there any specific demographics more susceptible to it?
Yeah, and I think in particular, hypothyroidism or these autoimmune conditions are particularly seen with a bit of higher prevalence in the Western population or the Caucasian population, but a significant number of our own people, Asian patients, have hypothyroidism. There's nothing in particular that we will be able to do to prevent hypothyroidism because it's an autoimmune condition by and large, which means the body produces certain antibodies which are abnormal proteins which then interact with our thyroid and makes our thyroid go hypothyroid or underactive. So there isn't anything that we particularly could do to prevent it because we can't prevent or control autoimmunity as such. But what we could do is once we know that the autoimmunity has caused hypothyroidism, we can give the same thyroid tablet to the patient. It's essentially the same thyroid hormone that's produced by the thyroid gland in the body, and that will keep the thyroid levels well within the normal range, which means essentially that the patient will have a normal thyroid for life.
Okay, doctor. Doctor, what role do genetics play in the development of hypothyroidism?
Genetics do not particularly play a role in hypothyroidism because, as I said, this is more to do with autoimmunity or production of antibodies in the body. But then genetics do play a role in autoimmunity. But then that's the wider part of autoimmunity which can affect any organ of the body, not specifically thyroid. So genetics is not something that we strongly consider when we either diagnose or treat hypothyroidism.
Okay, doctor. Doctor, could you explain the importance of thyroid function tests and how they are interpreted?
Yeah, thyroid function tests typically are three in number. One is called the TSH or the thyroid stimulating hormone, which is produced by the master gland of the body or the pituitary gland just underneath the brain. And the other hormone is called the T4 or thyroxine, which is produced by our own thyroid gland. And the last one is the T3 or the triiodothyronine. The T4 gets converted to T3 in the blood once the T4 is submitted to the blood by the thyroid gland. So when we say thyroid function test, we typically mean TSH, T4, and T3. And in hypothyroidism, we sometimes also ask for thyroid antibodies known as TPO antibodies, which could be the reason why the thyroid has become underactive. So these are the classical tests that we do, and the interpretation basically depends on the value of these tests. So typically in hypothyroidism, the TSH levels will be high and the T4 and T3 levels will be either low normal or low. So this is how a diagnosis of hypothyroidism is made based on the thyroid function test results.
Okay, doctor, do lifestyle factors contribute to hypothyroidism? How do an individual can make a positive changes to support thyroid?
There are a couple of things that could help the patients with hypothyroidism apart from taking, in addition to taking the thyroid tablet regularly. One is there are a few dietary factors that could affect the thyroid hormone production. So we typically say patients with hypothyroidism to cut down on consumption of cauliflower, cabbage, broccoli, and soybean. I'll repeat: cauliflower, cabbage, broccoli, and soybean. There is some evidence in scientific medical reports to say that Exercise might also help, but that's not a strong evidence. But exercise would be good for general health anyway. So diet and exercise can play a part, um, but diet particularly. And apart from that, there isn't anything else that we need to be considering. What is more important is to take the thyroid tablet, in an empty stomach in the morning, and there shouldn't be any sort of eating and drinking for at least for the next 45 minutes. One can drink water, but no coffee, tea, or breakfast, because food or drink will interfere with the absorption of a thyroxine tablet in the body. One might be taking 100 micrograms, but the body might not be getting 100 because there's no absorption. And hence, it's very important to take the tablet in empty stomach.
Okay, doctor. Doctor, what are the different types of medications used to treat hypothyroidism?
Yeah.
And how do they work?
The vast majority of the patients, 99% of the patients, will need a single tablet a day of thyroxine. It comes up as thyroxine sodium or levothyroxine, well known by the brand names of Thyronorm, Altroxin, and Euthyrox, and many others. So this is the only medication that's available universally to treat hypothyroidism. It's just the same thyroid hormone that's produced by our thyroid gland. And excuse me, in a small minority of the patients, you might need an additional tablet called T3 tablet, which is now available in India, but that's only in a small minority of the patients who, despite being on good dose of thyroxine, the hypothyroidism is not controlled. But that's a rare situation.
Okay, doctor. Doctor, are there any natural or alternative therapies that can complement traditional medical?
Not that I know of, because the classical treatment throughout the world for hypothyroidism is thyroxine tablet. And there is no alternative medications. But again, there are some claims in alternative medical therapies that they might be able to treat hypothyroidism, but I'm not expert. I'm not an expert in alternative medical therapies. So as far as I understand, thyroxine tablet is probably the best way to go.
Okay, doctor. Doctor, can the hypothyroidism impact mental health? And what if so? What steps an individual should take to manage?
That's a very good question. Hypothyroidism typically affects the mental health when it comes to two particular aspects of the mental fertility. One is memory, and the second is performance of mental tasks. Typically, I have patients coming in with complaints of loss of memory, loss of short-term memory, inability to retain even the simple things which they were able to a few months ago. And this was apparent either at home or at workplace. That's one. The second thing is a reduction in the capacity, the mental capacity of doing few tasks, mental tasks. This usually is identified by the colleagues at work, with a comment saying that the person has slowed down a bit. So which means that that the processor is not working fast enough. So the two main issues of mental faculty that gets affected in hypothyroidism is memory and the ability to perform some selective mental tasks, particularly calculations and planning.
Okay. Doctor, how can then individuals effectively communicate with their healthcare providers and about their hypothyroidism symptoms and concerns?
The best is to see an endocrinologist who has experience in treating thyroid patients. Explain to the endocrinologist the symptoms they have, and it is very likely that the endocrinologist would advise the thyroid blood test that I just enumerated, the TSH64, T3, and the thyroid antibodies, and that will give us the diagnosis. It's as simple as that. Just suspect hypothyroidism, get the thyroid function test and see the endocrinologist, or see the endocrinologist, get the thyroid function test. And then if hypothyroidism diagnosis is made, get it treated. It's just a simple one tablet a day. That's all the treatment you need.
Okay, doctor. Thank you so much, doctor, for giving us wonderful insights. And thank you, viewers. To book an in-person appointment with our Dr. Manjunath Malige, you can download our app, Sakra Patient app, and book your appointments, or you can log into sakraworldhospital.com and book an in-person appointment with doctor. Thank you, doctor.
Thank you very much.
Thank you so much.